Here's an ultrasound image of the uterus. We can see that this is a transvaginal ultrasound given the shape of the convexity of the ultrasound probe. And so this is a transvaginal ultrasound image of a postmenopausal patient to evaluate the uterus. And so here we can see the uterus, we can see the endometrial stripe right here. And if we follow it in here, we see this large mass within the posterior aspect of the uterus. And the interesting thing about it is that it's quite echogenic. Most of the masses within the uterus end up being leiomyomas, and those tend to be more hypoechoic, but this one is hyperechoic. And in a patient who's postmenopausal, one of the things that we think about when we see a hyperechoic mass within the uterus is, well, maybe two things. The first thing would be a calcified fibroid, and that's quite common. Things arguing against that this would be a calcified fibroid is the lack of posterior acoustic shadowing. We don't see that clean posterior acoustic shadowing that we'd expect to see in a calcific fibroid. But the other thing that can happen to fibroids, and it's a variant of a fibroid, is a lipoleiomyoma. These undergo fatty metaplasia of the fibroid itself, undergoes fatty metaplasia, and so they end up having fat content within the fibroid, which gives it this echogenic appearance. Now, this patient ended up also getting an MRI of the pelvis, and you can see here's the in-phase image of the fibroid back here. And when we go to the opposed phase imaging, we can see that there are actually areas of dropout within this fibroid posteriorly. And so that's consistent with intravoxal fat deposition. So this is a patient who has a lipoleiomyoma.